So look, we have spent a lot of time lobbying MPs and ministers during this campaign. And through that, there has been one party that has consistently come forward to advocate for the rights of allied health workers. And one MP in that party who has really carried the torch for you during this campaign, whether it's wearing orange on Fridays or interrogating the Minister of Health in the House. And so for that reason, we're very excited to have her here today. So wherever you are, please join me in welcoming the Green Party spokesperson for Workplace Relations and Safety, Jan Logie.
Kia ora koutou, and I hope you can hear me. The neighbour's skip is just being picked up right at this moment in time, so it's a bit noisy in the background. So hopefully you can hear me and understand me. And I first of all just want to acknowledge it's a real privilege to have sat in on this session and listened to all of you sharing your stories. And it's right, and I want to thank the PSA up front for organising the meeting with some of the county's Manukau allied health workers with me quite a few weeks ago now, because that was what got activated me and the Greens in getting engaged in this, because the stories that we told, which are consistent with what we've been hearing today, I just found so profoundly shocking, to be honest. The fact of people regularly working double shifts as social workers, of seeing people have heart attacks in their workplaces, of seeing colleagues leaving for the private sector where they were being paid tens of thousands of dollars more than what they were in the public sector, of seeing, colleagues who they were working in a team with, but who were nurses, not the specialists, being paid more to do the same job that they were doing. That created tensions within teams, of saying that they were seeing new young people coming in, graduating, coming into the public sector and then leaving because of the stress and a sense of being undervalued. And I just came away with this picture of our precious, precious public health system crumbling because your essential work is not being properly valued or paid for. And as a New Zealander, and I'm not going to speak as a politician when I'm saying this, whose family has needed our public health system several times in the last few years, we need you. There is no question about the fact we need you. And I really have felt that through COVID and a pandemic, everybody has got that, that we need you. And that we've got to value your work and protect you to be able to keep the system going. And after that meeting, I think it was the next couple of days, I was in select committee and we had WorkSafe, who oversee the health and safety in the country, and they have that legislative responsibility. And I was asking them about what they were doing in terms of protecting the health and safety of you all in our health system, and was really disturbed to find out that WorkSafe have got 3 sectors that they are particularly concerned about. That obvious ones, forestry and construction. We know there's high levels of deaths within those sectors. The third is health, because of the health and safety issues they are seeing in your sector, and that is largely a result of underfunding and inadequate staffing. And that is on government, right? And that, to me, is just the most appalling situation, that one of the sectors of most concern would be a public sector where government is responsible for it. And WorkSafe said that they are looking at the legislation where there's an upstream duty for funders in terms of the decisions they make having an impact on health and safety. And that they have been having those conversations with the Ministry of Health, and that there would be the possibility, if things don't improve, of enforcement action. And when I asked the Minister for Workplace Relations about that, he said he was pleased that those conversations were happening. There had been discussions in Cabinet, and that it was important that our public sector wasn't treated differently to the private sector. The Minister of Health had a different perspective in the House, however. So that is an area that we will keep exploring, and we will keep the pressure on, because you have a right to be safe in your job. And that is safe physically, but also safe from burnout. And we need you. So I really want to let you know that the Green Party is standing with you in solidarity, and will do whatever we can to be able to support you in this cause, because it's actually a fight for all of us, not just yourselves.
Well, thank you so much, Jan, and thank you for your ongoing advocacy for these members in this campaign. And also just want to acknowledge Jan's colleague, Chloe Swarbrick, who has also met with allied health members recently. And we are initiating some work with her specifically around allied mental health members as well.